As information gets out about the most historic update to veteran health care, more veterans are filing or even refiling to get care and compensation. And the Cincinnati VA is launching a mobile unit to help get the information out to the community.
So veterans tend to grow increasingly frustrated. Once you've been told no, you probably don't want to try again.
Mike Farmer is a Marine Corps veteran, and as the executive director of Butler County's Veterans Service Commission, he's trying to get veterans who've had their claims for benefits from the VA denied to come back through his door.
The eligibility requirements have changed, presumptive conditions have changed. So many people who have always been told no, the answer is now yes. How can we help you?
The PACT Act was signed into law last August, but word on what veterans should do is now slowly making it to those impacted by burn pits, Agent Orange, and other toxic exposure during their military service, leading to a laundry list of cancers and other illnesses.
We really want to talk to people about what toxic exposure have you been involved in. And if you've been in war, you've been in toxic exposures.
I spoke with Ellen Graff with the Cincinnati VA Medical Center. She says the PACT Act is so far-reaching that it covers many veterans who've never stepped foot inside a VA facility and provides even more benefits for those who have.
In theory, this PACT Act will clear up a lot of that frustration for many vets out there who have been battling not only the fight with the VA to get health care and get that taken care of, but fighting for their life in some instances with cancers and different health issues that they're facing.
I think it's a new conversation that we're having here now. It's no longer, you're not eligible. It's now, let's see what you're eligible for. Let's see where you were, when you were there, what were you exposed to, what presumptive conditions are now being covered.
The change not only opens the door for more veterans to receive health care through the VA, it also could provide disability payments based on a disability rating ranging from 0 to 100%, something that could help Vietnam-era veterans exposed to Agent Orange who now have hypertension added to their presumptive conditions.
It's typically at 0% for hypertension. However, that's a huge win because what we in the VSO office use that for, hypertension causes all kinds of other medical conditions. So it's heart, kidneys. So we can use that to then claim secondary conditions based off of that single hypertension.
Mike hopes, as the word gets out, that both veterans who've never applied for benefits or disability claims or those who've been denied in the past will fill up his office and veteran service offices throughout the country.
Reach out, even if you've been in before, because things have now changed.
So in an effort to serve more veterans and get claim information out to the community, the Cincinnati VA Medical Center will launch their mobile unit operations next month. Service officers will be available for veterans and their surviving spouses to ask questions and to file claims as well. I put all the locations and the information in this online story on WCPO.com/homefront.